Good evening. I'm Elizabeth Barnes with Women of Hope and Hope Abounds, and we are so honored to have you here with us this evening. I have the privilege of sitting in for Lisa Cawthorn, who is our patient navigator here at Hope Abounds, and I'm the executive director and patient advocate as well. And we are so glad that you have tuned in with us this evening to Focusing on You, which is our educational program that is live streamed twice a month, and then you can also see it later on other venues that we'll provide you at the end of the program. But tonight we are so honored to have here with us Jennifer Shepard. And I've known Jennifer for a long time. It's good to have you here with us.
Thank you.
Of course, a lot of things have happened. We've known each other for about 8 years now. And during that time, we've done a lot of wonderful work together in the community, and I think growing our organizations and meeting the needs of our patients. But I was so impressed. I've always been impressed by your clinic and what you do through your practice, because you've done good work.
Well, thank you.
About
I
the
appreciate
awareness
that.
of lymphedema, which is something I became very aware of as our daughter was diagnosed with a very aggressive breast cancer.
Okay.
So to have the lymphedema to be something to come after that, you know, was very surprising. Never heard those terms or those words. But you have a very strong background, as I learned about you, that you graduated from the University of Vermont, I believe in 93.
I did.
As a physical therapist degree, and then you came to Wilmington.
I did.
So
I
tell
was
us-
cold. I was cold. So
you're cold.
I moved to Wilmington and started my career as an acute care therapist. And
Yes.
since then, I've kind of done a little bit of everything, inpatient, outpatient, acute care, nursing homes, home health, and really found my niche in outpatient. I started specializing in women's health in 1996 and just really enjoyed working with that population. So I relocated back to Wilmington in 2001 and really felt like Wilmington was a great area to start a practice. And I just felt the need to really provide a PT practice that really addressed the needs of women's health. So started the practice Physical Therapy for Women in 2001 to really address, like I said, the physical therapy needs of women throughout the lifespan. We were very fortunate. It was very well received in our community, both by people and healthcare providers. And so over the years, we have grown and expanded. And like you mentioned, we've been able to really grow into the cancer rehab, lymphedema population, as well as pelvic floor dysfunction. So we're really excited about it, and I am very grateful for the opportunity to be here tonight. I think our organizations are very similar. We focus so much on empowering people about their own health care, just educating people to, ask the questions and understand the health issues and concerns they may be having. So
And advocating for themselves.
Correct.
The empowerment that is. And but tell us kind of how your practice got started.
So when I moved back, like I said, we certainly saw that the need for women's health was here, and it just kind of grew from prenatal care to, osteoporosis, different women's health issues, and it was really obvious that we had a need for cancer rehab. And as you mentioned, a kind of a side effect or result of cancer treatment sometimes can result in lymphedema. So
Yes.
felt like there was definitely a need to educate our community and our caregivers and the patients themselves about lymphedema. So we've really enjoyed branching into that and providing those services to help all these people manage this condition.
And the name of your practice is Physical Therapy for Women.
It's Physical Therapy for Women. A few years ago, or 2 years ago, we did expand, and we expanded into a facility that does allow us to treat the male population as well. We quickly learned that men get lymphedema as
We're
well.
seeing a
Men
lot
have
of
pelvic floor
inquiries,
dysfunction.
yeah.
So we have been able to keep our niche as Physical Therapy for Women, and our new space allows us to have two separate wings so that everyone feels like they are getting their individualized
Oh,
care
that's
and
nice
still
to
keep
know.
it separate.
Yeah, because there are many more men that are being diagnosed with breast cancer.
Absolutely, absolutely.
And as we were discussing a little bit earlier, that we've seen such a age impact of when we started 8 years ago, the average age being 40 to 60, now being 18 to
Being younger.
45.
Yes.
Yes, so much younger. So exactly, a lot of people hear the term lymphedema,
Sure.
but they really don't know what it
Yeah.
is. Can you
And a
help
lot of
define that
times,
for us tonight?
sure. And a lot of times people hear, the first time they hear the word lymphedema is when they are diagnosed with it. And we are really trying to change that. We are trying to get it so that it's a word that people know, they recognize it, and they know what it is. So lymphedema, by definition, is an accumulation, an abnormal accumulation of lymphatic fluid. And it can occur in any area of the body. It can be in your hand, it can be in your arm, it can be in your leg, your face, your neck, your abdomen. It can happen pretty much anywhere. So it's an abnormal accumulation of lymphatic fluid. But I think you need to kind of understand the lymphatic system.
That's
so,
correct.
what is lymphatic fluid? So we're pretty familiar with the circulatory system. We know we all have a bloodstream. We have a circulatory system that transports our blood throughout our body. But there's another system that we have called the lymphatic system. And that is a separate set of vessels that transports what's called lymphatic fluid. Lymphatic fluid is mostly water, cell parts, toxins, and it's a healthy fluid in the sense that we all have it. It's normal fluid that should be circulating throughout our body as well in the vessels that make up the lymphatic system. It's very important in our immune system. It's what really helps to fight disease and different invaders in our body and illnesses and infections. So the lymphatic system is very important in our immune system. So the fluid is normal, the lymphatic fluid is normal, but the issue, or when it becomes lymphedema, is when that fluid is unable to be transported effectively. So there's an accumulation, it becomes sluggish, and it may pool in the hand or the arm. So just recognizing we even have a lymphatic system is a start, but then when something goes wrong and that fluid's not able to be transported, that's when we can kind of start to see that swelling and may get the diagnosis of lymphedema.
Well, and I think a lot of people, too, aren't aware of really what the lymphatic system is, which is the lymph nodes.
Correct.
And something, if you could kind of address that, where are the lymph nodes in the body and what you've kind of identified
Sure.
the purpose of what they do.
Right.
But we have them all through our body.
We do. We have groups of them, clusters of lymph nodes. They are kind of out throughout the body, but we have a cluster under our armpit, we have a cluster in our groin, we have a cluster in our neck and things like that. So in our lymph nodes, that's where our antibodies are produced. So if I were to get a cut or an infection on my hand, or probably more common example is if we have a sore throat. And we say, I feel like my lymph nodes are swollen. That's really actually a good response because that means your body, your lymph nodes are producing more antibodies. Yeah. And it is your lymphatic vessels that is going to transport those antibodies to the site of the infection to help fight the infection. So the lymphatic system, does a lot of filtering. It kind of removes the garbage out of the body, the toxins, the invaders, the bacteria, and it's always at work throughout the day. So it's a really, system we want. And it's just, like I said, the lymph nodes are throughout the body, and the lymphatic system is what transports the antibodies to the site of the infection or the invader, and then picks up the toxins and kind of brings it back to where it's filtered. So it's a very important system, and it's amazing that we don't hear that much about it.
Yes. But I think there's more and more awareness of it because, there are, and a point that you kind of introduced a little bit earlier that I want to bring attention to is that there are different types of lymphedema. Can you kind of address that?
Yeah, there's two main types of lymphedema. There's primary lymphedema and secondary lymphedema. Primary lymphedema is not as common, and it has a hereditary component. So primary lymphedema refers to an abnormality in the lymphatic system itself. So there's an anatomical issue, or a defect per se of the lymphatic system. Some theories are some of us are born with less lymphatic vessels, or our vessels are narrower. Okay, so that interrupts or affects the flow of lymphatic fluid throughout the body. The body can't transport the fluid quite as effectively because there's less vessels doing it, or the vessels are narrower. You can see lymphedema at birth. Okay, very uncommon, but you can see it in some infants, and it really can be developed at any stage during your lifetime. Okay,
that's amazing.
It is. more common in women. You typically see primary lymphedema in the legs, but you do see it. And
Through
in
the
knowing,
family.
in knowing, we kind of touched on that earlier, was knowing family history.
Yes.
Because there is that hereditary component. Many times, grandparents or great-grandparents had symptoms of lymphedema but were never diagnosed.
Right.
But we may remember, an aunt or a grandmother who said, she used to have one arm that was bigger than the other, or her legs seemed larger, just in proportion to the rest of her body. So primary lymphedema refers to kind of some anatomical differences or defects in the lymphatic vessels or system itself. Whereas secondary lymphedema, which we'll talk mostly about tonight, refers more to when there is damage or trauma, surgery. Some of the treatments we use for cancer actually cause some damage to the lymphatic vessels. So secondary lymphedema is a result of kind of something that happens to the system. For example, and our cancer patients need to be aware, hey, I had a surgery. I may have had a mastectomy, or I had, some tissue removed or things like that. And that can create scar tissue. So that scar tissue can interfere with the flow of the vessels. Or if you had lymph nodes removed, that's a big one. That's
Yes,
very
it is.
common, for surgical cancer procedures, is to have the lymph nodes removed. And that's a direct impact on the lymphatic system. Now you have less,
That's probably the
lymph
most
nodes.
common that people are aware of.
It is, so we can have surgery. Radiation is one people don't think about, but your lymphatic system is very superficial. Those vessels are just under the fatty tissue, or they're embedded in the fatty tissue of the skin. So radiation, we know, has effects on the tissue. So it can kind of squish those lymphatic vessels, so they're not quite as effective at transporting fluid. So radiation treatments can affect the quality of transporting the fluid. And even chemotherapy. Lots of chemicals in
Yes.
chemotherapy that save lives and are certainly necessary. But as we mentioned earlier, the lymphatic system filters things.
Right.
So it's an overload of what the lymphatic system has to filter as well. So sometimes there's not one thing that causes secondary, lymphedema, but it's kind of those cumulative effects of, the surgery, scar tissue, radiation, and possibly chemo that can just really wreak havoc on how effective that lymphatic system can be. So secondary, lymphedema we see more common.
Yeah.
For sure.
But I would never have thought that genetically, which family history would be primary.
Sure.
That was alarming. So I think as we talked, even earlier, that the one thing that you and I both are very passionate about is for individuals to advocate for themselves and to really be engaged in their health, to be very in tune to their body, know their family history, at least 2 generations. So, that when you go to your primary care doctor, that you can say, on your behalf and to advocate, I have these things in my family history. I had an aunt that had lymphedema, or I had an aunt that had one leg larger than the other. Never knew why,
Right.
But I've learned through watching a program, or going to physical therapy for women, that is something that's probably my family lineage. So, to address that more as an advocate for your family history and staying in tune to yourself. So are people more at risk? Are there certain people that are more at risk than others for lymphedema?
Sure, and that's, I think education is so important, and it begins with knowing if you're even at risk.
There you go.
And, you mentioned the hereditary, so that's kind of the one component for, am I at risk for primary, lymphedema? But as far as secondary, I think there's some confusion surrounding that, and it leads to people being diagnosed, or the first time they hear lymphedema is when they're diagnosed with it. And we really want to change that. We want people asking the questions, am I at risk? How great is my risk?
Right.
Is there anything I can do to decrease my risk? Unfortunately, at this point in time, lymphedema is not curable. So there's great ways to manage it, but there is no cure for it at this point in time. So that to me makes it so much more important, or just increases the importance of prevention of not getting it. Because if we don't have to manage it, let's do that.
Yeah,
you
so
know,
early detection,
So-
we can know that and
right,
do
and then
preventative
so
measures.
knowing, am I at risk for getting it? And
Yeah.
so some of those questions are, and we can't predict who's going to get it. And you'll read all kinds of different things, but the bottom line is, in the real life, there is no one gets lymphedema if they've had this procedure, or I didn't have chemo, so I won't get it, or
Right.
I only had one lymph node, so I won't get it. In the real world, it's all over the map. We see patients who have simply, had a lumpectomy.
Yeah.
Maybe a lymph node removed, and may go on to develop lymphedema. Whereas we also have patients, 28 lymph nodes removed, no visible swelling, no signs of lymphedema. So we can't just say, well, if you had lymph nodes removed, you're going to get it. Or if you didn't have lymph nodes removed, you won't get it. We really can't predict that. So it's my belief, and really how we educate our patients, is if you've had those treatments, it puts you at some level of risk. And because everybody's body is different, we can't pinpoint that risk. And I think at this point that's impossible to say you will never get it. So we like everyone to know what it is, and just kind of assess, well, I did have chemo, I did have radiation, I had 13 lymph nodes removed. So I really need to pay attention to my body and recognize changes and look into what I can do to prevent it. So the first thing, what you mentioned, ways to prevent it. One is assessing what is my risk. And so two, if you identify that, yes, I did have some things that put me at risk, there are some things to do. One is skin care. It sounds simple, okay? But we know that we get dry skin, we get little cuts or breaks in our skin, and that bacteria can easily enter our skin through breaks or cuts or dry skin. So one of our components that we do is to really educate people to keep their skin well moisturized. So frequent lotion with a low pH on that area where they're at risk for swelling. That also keeps you looking at it and say, oh, look, I've got this hangnail. What can I, just to avoid infection? Because we know that if we have an area in our body that is infected, your body is going to send lots more lymphatic fluid down there to fight that infection.
Right.
We don't want to overtax that arm or that leg any more than normal. So, we want to decrease our risk of infection. So if we notice that we have a cut, or we have a bug bite, or we have a hangnail, we want to be real meticulous about keeping it clean, keeping an eye on it, and just, keeping the skin well moisturized so we don't get, dry cracks in the skin. So skin care is important. Avoiding blood pressure cuffs, on that involved arm or that involved limb.
Absolutely. Mm-hmm.
Blood draws, those are needle sticks. The risk may be slight, but let's use the other arm. Let's use the leg if we need to. So just really taking care, again, of the skin. Avoiding really tight garments, elastic bands or really tight bands around the limb. And things that make a good rule of thumb is things that make the limb warm or red. So we want to avoid sunburns. We want to avoid infections, like we mentioned, and also soaking for a long time in a hot tub, just because that does increase the fluid down into that arm. And a big one that we really try to push is, which you may not think of, but is air travel. So many of us fly to see family, so we may be at risk. And what we want to do and what we recommend is obtaining a compression garment, a prevention compression garment that is worn either on the legs or the arm, wherever you're at risk for developing the swelling, for the duration of the flight. So it can be something as simple as putting on an arm sleeve, landing, and then taking the arm sleeve off. But it just prevents that accumulation of fluid in that arm. So
I know Kelly was even told in taking long automobile trips, if it's excessive, is helpful.
Yeah.
And I see you brought some samples of that.
I did. There's lots of different compression styles. And I think it's just really important to know there's a lot of options, because sometimes we have in our mind a visual of some compression that we saw 10 years ago, and it looked very medical, and it was like, oh, I don't want to wear that.
Yeah,
Everybody's going to think I broke my leg, We still have those.
Yeah.
We still have those.
But we can look pretty at the same time.
But there's still lots of options. And I
Yes.
did bring some here today this is such a small range of what's available. But there is, there are gloves that
This is
compression
referred
gloves.
to, I believe, as a gauntlet.
As
Is
a
that
compression
correct?
glove, because it has the fingers. But if
okay.
it comes without the fingers, then it's a gauntlet.
Oh, okay.
Because some people, depending on their work or what they do, or if they don't have any swelling in their fingers, don't need, the compression there. So a gauntlet. We've got some arm sleeves. And so this is the one that everybody recognizes,
daughter
and
wears.
it comes in lots of different skin tones. But they have gotten really pretty. So this one looks like a painting.
Now,
to me.
these are for the arms.
These are for the
correct?
arms,
Because
yep.
our daughter also has the stockings.
Yes.
With her congestive heart failure that she's developed.
Yes.
With the lymphedema as
Yes.
well. So she wears them on her legs as well as her arms.
So these are a bunch of different prints.
I
They come in
like
everything from
them.
tie-dye to is
this
fancy.
one looks like a
I know,
tattoo
I
when
know.
you see it.
So, you can really
Yes.
make it. I mean, if you're told to wear a compression sleeve or compression socks every day for the rest of your life, let's make it fun. Let's make it
Yes.
you. Some days you may want to wear a black sleeve. Some days you may want to wear a tie-dyed sleeve. But just
Yes.
knowing that there's options.
Yes.
And then for the legs, there's everything from open-toed, closed-toe. Here's some different knee highs. Who would have thought? You mentioned the younger population
That's
too
right.
that are being diagnosed, and these are very appealing to them. These look like sports socks, but they are a therapeutic compression level. They have knee highs. We have open toe, closed toe. You can get knee highs, thigh highs, pantyhose, face masks. We measure for custom face masks at times. So there's really. We can apply compression to any part of the body, and there's lots of different styles and types. Now, some people probably say, oh, I've tried compression. I can't get that on. And yes, I'm referring to my family when I say that, because I have sent them some compression, and they have sent it back saying, I can't get that on. Sometimes it's, in my family's case, it's being wimpy, but sometimes you can modify or really look at the different things that are out there. So this is kind of the go-to. It's the, kind of the simplest to put on, but compression comes in many different forms. And so as a therapist, we really look at what does the patient need for compression, but matching that with what's out there. Because I may say, you need a 30 to 40 compression in a thick garment. But if they have arthritis in their hands and they live by themselves, there's no point in giving them this garment. Or if they can't tolerate it from a temperature standpoint, or they're not going to wear it, so we really try to match them with a compression that they can put on and off, that is still effective, but it may not be the ideal compression from a therapist standpoint.
Right.
But some compression is better than none. And just knowing there are lots of compression options out there. This is one I brought in today just to show. This is called a Ready Wrap. And this is a Velcro wrap compression. It does deliver a therapeutic compression, and it comes in several pieces that's available for the arms or the legs or just the foot, calf, knee, thigh, all the different pieces. But, there's a lot of creativity behind compression, and just compression is so important that, different garments have been developed so that everybody hopefully can find something that matches what they need, but also fits into their
Well,
lifestyle.
because if it's something that has been diagnosed that you need to wear,
Correct.
there is a purpose.
Right.
And there's repercussions for not
Right.
wearing it. So you definitely want to take that very seriously. What are some early symptoms of onset of lymphedema?
Sure. So if you know you're at risk, and you're doing everything you can to prevent it, the next step is really kind of saying, how will I know if I get it? Like what should I expect? In some of them, we know that lymphedema actually begins before we see visible signs. But the first things that some people will start to notice is, maybe your rings are a little tight, or your watch feels a little bit, more snug than it's used to. Or you may notice that, my arm just feels a little bit more heavy or tight or tired. And thanks for asking that question, because it's not painful. Typically, lymphedema by definition is not painful. Now, it can become painful
Yes.
if it's very heavy,
And
and
tight.
there's swelling in that tightness. But we don't want to wait for pain to go to the doctor. So that's
Right.
why I say it's not painful, because it's developed, prior, usually before we feel that it's painful. But a heaviness or a tightness in the skin, or the skin can feel kind of tough, where those proteins have kind of built up in the tissue. but yeah, or just your shirt starts to fit differently. Like this sleeve feels a little tighter than this one. So being aware of your body, looking in a mirror, looking for
So
symmetry,
important.
you
Yeah.
know, yeah, I don't
It's not
like
being
looking.
vain.
Yeah, I don't like
It's
looking
just-
in the mirror,
it's
as you well
advocating
know,
for yourself.
any more than
Yeah.
anybody else. But really, just looking, on a regular basis, do I see changes? One side, or do I look symmetrical from one side to the other? And just trying to notice when there's subtle changes, and then asking the questions: Hey, could this be lymphedema? Can I see a lymphedema therapist? And things like that early on, so we can get in and start to manage way earlier than full blown
Right.
lymphedema.
And you could say, maybe it is not at this time, but you are showing some early signs of being at high risk that we need to do a surveillance
Right.
probably program on and
Yeah.
getting you in annually or every
And what
2
we
years.
do is we take measurements. So
Yeah.
we get your
Okay.
baseline.
There you go.
So if you question it, even if I look at someone and I say, I don't see any asymmetry, but they're at risk, and so they're sent to physical therapy. It may or may not be for lymphedema. It might be for scar mobilizations or range of motion or strengthening or anything else. But I'm going to go ahead and take measurements so that in 6 months or a year, when this patient calls and says, I'm worried,
Right.
I'm concerned, and we can say, well, let's, we have a baseline to say, here's where it was, and yes, there has been some changes. So now we might need to step up our game and do a little bit more of a treatment aspect, instead of just prevention.
How does
Yep.
physical therapy make a difference in lymphedema?
We would like to think it makes a
in
huge
solving it.
difference,
Yes.
and our patients certainly give us that feedback. One, I think the education. I think patients come in, they got this scary word diagnosed. They don't know what it is. They don't really know what that means. Is it a disease? Is it going to get worse? Is it cure? They don't really know what's going to happen.
Right.
So one of the things, I think as physical therapists, we have the perfect opportunity to say, one, we're here for you. We're going to help you manage this. We are friends for life. We're going to be your resource, and to kind of trust us to say we're going to guide you through this process so that you can manage this effectively. And they seem so relieved, like they kind of sit back,
absolutely.
like, oh, you've heard the word,
Yeah.
and that we know what to do. And so, just we try to make them, if there's any pain, certainly by getting swelling out and relieving pain, helping to get them to keep their normal daily life. We're not there to say, stop using the arm, don't use the legs or anything like that. We want them to maintain their daily activities, whether that's golf or tennis or, doing their yard work. We might have some recommendations for modifications, but our goal is that they're pain-free. They have an understanding of what lymphedema is, how it can or cannot progress, and then being able to say, hey, I can manage this, and I just have to make these changes in my life.
Well, and it's all being proactive. So tell me, I've heard of an acronym that you can explain much better, CDT. Can you tell me what that is?
So complete decongestive therapy is like the most aggressive way to treat swelling. And if I back up just a second, so if a patient comes in and they have swelling, and we see patients at all different levels per se. Some people, we really can't visibly see the swelling. Other times there may be a little fluctuating swelling. Then we may see significant swelling. And then there's the cases we may see severe swelling with wounds and some weeping and some, so we see all different levels of lymphedema. All at different stages.
I didn't know about the wounds.
Yes. So as if the swelling is not contained and it's not
Yes.
treated, oftentimes they'll start to develop frequent infections called cellulitis, where it requires hospitalization and things like that. And then we often see that develop into some wounds that require, a little bit more care. These are all things we try to prevent with early recognition and getting people on board. But yes, there are definitely cases that we see that are much more advanced and down the road.
So if it is that advanced, it still can be treated
Yes.
outpatient physical
absolutely.
therapy. Okay.
Absolutely. And we've seen some excellent results, with that. But say someone comes in, initially there's four different components to treating physical therapy or to treating lymphedema. Number one is the skin care. Again, we want to keep the skin intact. We want to keep it free from infection or cuts or anything that can further tax the lymphatic systems. We want to keep that arm or that leg healthy. Number 2 is manual lymphatic drainage. Manual lymphatic drainage is a very light type of manual therapy, not to be confused with what we view as massage, but it is a light, very specific type of manual therapy that stimulates the lymphatic system. Okay, so it encourages that lymphatic flow to move faster, to get the swelling out of an arm or a limb. So we do manual lymphatic drainage in the clinic, and because our goal is that everybody's independent with management, we certainly teach the patient, caregivers, family members to be able to do the manual lymphatic drainage at home. That is crucial, okay, because the manual lymphatic drainage is what gets the limbs smaller. That is what is going to move the fluid. Okay? So very important that that is done for most people on a daily basis. And it can be done at home, 15 minutes, it depends, but that's kind of a general rule. And then the third component is compression. So that's where our compression garments come in handy. So the design or the purpose of compression is to maintain the size of the region. So if I do manual lymphatic drainage and I get my arm, to a smaller circumference, if I don't do anything, it's just going to reaccumulate. So the purpose of compression is to put that compression on to prevent that reaccumulation. Okay? So all of these components really work together, and you can't just say, well, I like the sleeves, I'll wear the sleeves, but I'm not going to do anything else, Or the manual feels great. I mean, some of our patients are like, oh yeah, I love my manual therapy. But we also have to follow that up with the other components. So compression its goal of compression is to maintain, the gains that you made with the manual lymphatic drainage. And then the fourth is exercise. We've got to move. We know that movement is good for all of our bodily systems, but it is very important for the movement of lymphatic fluid as well. So the act of our muscles contracting, even if it's a simple walk to the mailbox, encourages that lymphatic flow. So it just really gets things moving. And you can wear your compression, while you're doing your exercise. If you're going to the gym or walking, we want all of that. So the 4 main components are skincare, manual lymphatic drainage, compression, and exercise. Now, as you mentioned, complete decongestive therapy, that is like the big deal. That is reserved typically for patients with significant swelling or who are not responding to some of the more conservative approaches. So this is when you have a chat with your therapist and say, or your therapist has a chat with you, because there's a big commitment there. And everybody's got to be on board because it is a very aggressive, time-consuming, it's a big commitment. So complete decongestive therapy takes those 4 components, but it really, drives it up a notch. So a patient would expect to come into therapy, get the manual lymphatic drainage to move the fluid, and then instead of going to a compression garment, we would layer with several layers of a fluff material and compression bandages to and we may wrap, if it was a leg, we would wrap from the toes up to the groin with multiple layers of compression wraps. And then they would leave the clinic. They would go home, and they would come back the next day. They would stay wrapped the entire time. We unwrap the arm or the leg or whatever body part we're working on, and we wash the leg or the arm, and then we do the manual lymphatic drainage again, and we wrap it back up. This is done on a daily basis.
For how long?
Typically 2 to 3 weeks. Okay, so it is a commitment, because sometimes if someone's wrapping both legs, they can't drive. And there's a lot of things you can't do if your arm is wrapped, so you need to really have that talk and say, look, this is the most aggressive. It will be the most effective. It's extremely effective. And when you're unwrapping that arm some days, it's like Christmas. You're unwrapping this present because people, there's a lot of tears. There's a lot of tears shed then because they're like, look, I have wrinkles, It's a time when we want to see wrinkles, where the fluid is gone and the skin is, so the circumference of the arm or the leg is so much smaller. But the goal of complete decongestive therapy is to really not give the body time to reaccumulate that fluid and just be very aggressive at getting the swelling down. And the goal is then to go into your off-the-shelf or custom compression garment. So the wraps, it's a lot, but it is a short, acute phase of treatment designed to get you to where you can wear a nighttime or a daytime garment to further manage down the road.
Okay, which you've already answered. Then my next question was, do you wear it 24/7? So they're so beautiful. I didn't know if you had one that you wear at night.
There
and
is,
then one you wear at day.
the
and
ones I brought,
where do they get them?
Sure. These are daytime garments. These are daytime sleeves. There are different styles. This one could be, the Ready Wrap can be a day or a nighttime compression garment.
Okay.
And then there is a few different types and styles of nighttime compression garments. They tend to be quite bulky, more of like a foamy feel, that are designed specifically for the night. So you wouldn't want to wear your daytime compression at night, just because it doesn't allow, you're not moving, so you're not having any muscle contractions, you're lying still. So it's a little too much compression to wear at night. But there are specific garments that are designed and with the weave to specifically address the nighttime. So some patients can get by with wearing their compression garments just during golf or tennis or yard work. Some patients will say, you really need to wear your sleeve every day, which refers to your waking hours when you're not in the shower. And then other patients, unfortunately, do have to be more aggressive with their compression and be wearing one style compression during the day and one at night. So we look for like a 23 out of 24 hours in the compression to really maintain
So
it.
it's just individually,
Yes.
assessment of how to,
Yes.
and then to work together as a team. But they do know that when they come in and they begin physical therapy, it could, depending on their level of where they come in
Right.
at, it could be an everyday program. It could be coming in a couple of times a week. But it is a very serious commitment that they're making to do
Yes.
their part at home,
Right.
when they're coming into the practice as well.
And I feel
So-
like by educating them, then they know why they're doing it. We're not just sending them home and saying, do these 5 things to manage your lymphedema. We really have a lot of passion about wanting people to know not only about, what lymphedema is, but why is skincare important? Why is the compression important? Why is the manual drainage important? Because I think people are going to buy into it and be a lot more compliant if they know why they're doing it.
Yeah. So what are the goals, really, of therapy? Because obviously it's not something you can do indefinitely. So what is kind of the maybe plan,
Sure.
length of time maybe that a patient would find themselves in?
Right. So day one, we do talk about the plan and say, here's our goals. And we ask our patients, what are your goals?
you
And then
go.
we kind of have our goals in the back of our mind too of where we'd like the patient to be. But what are their goals? Where are our goals? And the end goal is that they can ideally manage their condition independently. Okay, that they have the knowledge, they've been empowered with the education to really know what they're dealing with, to recognize changes, and to be able to know when they need to see a healthcare provider and know when they're doing great. So really, it's independent management. As we mentioned, lymphedema is not curable, so we have to think long term. What are we going to give this patient long term? Insurance is sometimes limiting, or there's different reasons, and obviously patients can't come to therapy indefinitely. So our goal is to get them to where they've got their compression, they've got their home exercise program, they've got the knowledge, and now it's their turn. Now they've got to continue that management. So that's our goal, is independent, successful management of lymphedema, but keeping in mind we're a resource.
Right.
It's there's always research being done. There's new recommendations. There's new products out there. So when we give them a compression garment and they're independent and they're discharged from therapy, we always say, call us if you have any questions, if there's any changes, if you lose weight, gain weight, your garment gets snagged on something. Don't just say, oh well, So we're always a resource, whether it's to just say, hey, I think there's some changes. We'll remeasure you. Let's see. You don't have to wonder if there's changes. Come on in, we'll measure. So we want to be a resource so that they feel like they have a healthcare partner, that knows about lymphedema and is going to kind of be on that journey with them and can answer questions and address changes and say, hey, we've got these new products, or this is a lighter weight compression and, different things like that. So we certainly want to be a resource for them.
Right. So being that there is not a cure, they're
Right.
going to come in, they're going to learn the tools and how to manage it on their own.
Right.
And you get it down, you meet those goals that you set with your patients. How many times does it go back to a bad condition again,
Yeah.
reoccurring? Is there, you have a success rate, but does it reoccur?
Yes. You know, and it can, absolutely.
Okay.
And that's so individualized per the patient. Sometimes it's related to the cancer progressing or returning and presenting different issues.
There.
Okay.
Yeah.
Maybe they couldn't wear the compression for a while because they had to have additional surgery or revisions or things like that. So the swelling, progressed a little bit. Or it could be compliance. They were doing great. They went on vacation. They forgot to pack to pack their garments or their compression. They were on vacation. They didn't want to, really do their exercise program or their recommendations, and then they came home and they did so well over vacation that, you kind of forget.
Yeah.
We focus on problems and pain, and
Or we think
sometimes
we're
when,
cured,
and when
really,
things are good, we're like, I moved on to something else, So sometimes it is compliance, or they just kind of got complacent with the recommendations, and it kind of left the forefront. The years, from the diagnosis of cancer have increased, which is phenomenal, and they want to kind of sweep that away. And sometimes we see that. But in other times, something could happen. If you break your arm, and that happened to be the arm that was, involved with lymphedema, that can create, an issue. Or if we get an infection or something happens, that certainly can cause a flare-up, as we kind of refer to it, where it is still manageable, and those patients, come back in, and we say, okay, we just need to, kind of get back on it for a little bit, and you'll get back there. It's we'll get you back.
Well, that's so reassuring, and to know that you're there, you know. And sometimes we do let life get away with us, and we put other people before ourselves. And so, especially as women, that's kind of our tendency to do. Our children and husbands come first.
Yeah.
So, how does someone get to see a physical therapist? How would someone come in to be contacting you?
Okay. So in the state of North Carolina, and this does vary, by region, but in the state of North Carolina, we do have direct access. So you could walk into a physical therapy clinic and say, I'd like to schedule an appointment, and that is fine. However, we're still limited by insurances. Many insurance plans do require a physician's referral, to come in. So that's where you want to ask the question, or you want to discuss with your healthcare provider, hey, I'd like some education, or I'm having some symptoms, or I'd like to speak with a certified lymphedema therapist. And we do recommend, if you are concerned about lymphedema, or you just want to hear the precautions, or have someone kind of assess your risk, or kind of discuss it with you, really look for a therapist who is a certified lymphedema therapist. That just really ensures that therapist has had a tremendous amount of additional training and can really give you the ideal information, the most comprehensive information that you're looking for. So, but you can, get your appointment. It is covered, as it would be for physical therapy. So whether you had back pain or a knee replacement, whatever your insurance would pay for physical therapy does apply to lymphedema as well. So sometimes we'll encourage patients, if they're concerned or have questions, is just to call your insurance carrier and say, hey, what are my insurance benefits for physical therapy? In our office, we are in network with Medicare, most insurances, and we check them all prior to patients coming in, so that we can give, that information, because that's an important component too, is the financial aspect. What am I going to be responsible for, in the coverage? So, but in general, really just looking to see where your certified lymphedema therapists are, talking with your healthcare provider, and just calling the office and saying, hey, can I talk to a lymphedema therapist? It can be helpful. We have lots of people. Every, week we have calls of people who just want information. What would I expect? What would you do? Here's my little bit of my history, and to see if it's appropriate for them to come in.
Oh, wonderful. Well, I also have noticed that you have expanded your services, not only from lymphedema, but also to do with the pelvic floor for women. And can you talk to us a little bit about that?
Sure. So in our name is now expanded to be Physical Therapy for Women, and it's Lymphedema and Pelvic Rehab Center. In the development, when it started as Women's Health, we realized there's a lot of women that have pelvic floor issues. And when I say pelvic floor issues, everybody's like, I don't really know what that is. I don't know what that is, but it's down there somewhere. So it can be urinary leakage. It can be bowel leakage. It can be urinary frequency. It can be pain with intercourse or the inability to have intercourse. It can be pain or changes that occur during the childbearing year or during menopause. Some issues can happen, or after hysterectomies or different surgeries. Constipation is a huge one. Rectal pain, coccyx pain. All of that kind of falls under the umbrella of
and
pelvic
all those
floor
happening as we get older.
dysfunction, and male or female. So that's why we have our male wing too, and to be able to address that population as well. But I know that's not the focus of tonight, but that really is something we're very passionate about and do some really phenomenal things. And patients are so appreciative of, again, the education and empowering them with what is going on with this part of their body. What can they do that's not surgery or medications? We do biofeedback, we do electrical stim, we do internal work as well as external work. And there's just a lot of gains that can be made in an area or a diagnosis that we're so often taught to just accept. I had kids. I'm 60. I've been through menopause. These are just things that happen. My bladder's falling out. Well, those are things that happen, but there's so much we can do from a musculoskeletal standpoint and behavioral standpoint, like knowing how much water to drink or how often we should be emptying our bladder, or just, some simple things that nobody really ever told us, but can be so effective in alleviating those symptoms that we've just dealt with because we just thought we had to. So, yes, that's been a huge area for us, and it's been very successful. And we're very encouraged that, just like the cancer rehab and lymphedema, about educating, men and women. There's a lot of things that we do that can really help long term.
Well, I'm so glad you touched on that, because the awareness of it.
Yes.
A lot of people just attribute it to aging or other things going on in their body, but to know that there is a place that they can go to for assistance and resource. Right. But if you were to give one piece of advice to the listeners tonight, what would that be?
In general, I think what I would say is to really be your own advocate, to ask the questions, to know your body, to be aware of changes, but not just accept them, but to ask the questions to your healthcare provider. And if you don't get the answers, you just ask again. And again, until you do get those answers. And if you feel like you're not being listened to or they're not hearing you, I think it's important to say, I need to surround myself with a healthcare team that I'm confident in, that is hearing me, and that, understands what my concerns are.
Absolutely.
But we have to be our own advocate in many areas of our life, and certainly in healthcare, when there's a push and a drive and everything's fast-paced, that we have to be the ones a lot of times to sort out what we're dealing with.
We do. We have to keep our whole team even communicating, and that unfortunately does fall on us, and we have to take ownership of that.
Yeah.
So
asking the questions and being your own advocate, and the internet can be a great resource and also a very scary place. If you get a new diagnosis or you read a test result and you go out there, there's a lot out there. So making sure that you look at trustworthy sites or good resources that are going to give you the straight up information, and then ask the questions. And, you're going to learn things that not only will benefit you, but also your family or your friends. And you're going to learn things and say, hey, I know you went through similar treatments than I did, I did. And here are some things I learned,
Right.
So not only can we be an advocate for ourselves, but also those that we love and those that are around us.
It can be a great testimony to others, that may not have had to go the route that we did.
Right.
Because we were able to be a tremendous testimony of that. Well, I understand you have a great event coming up soon.
We do.
So can you talk a little bit about that?
We do. In March, we're very excited about it. This will be our second one that we have done. But March is National Lymphedema Awareness Month.
Oh.
Not many people know it because not enough people know about lymphedema. So at our practice, I know we're trying. We're trying.
Yes.
So March is National Lymphedema Awareness Month. So we are going to have an event at our practice here in Wilmington. that on a Thursday, I think it's March 22nd,
Okay.
where we invite both the community. It can be patients that we've had in the past. It can be anyone, family, friends. We have some different healthcare providers that are going to be in attendance. We're going to have lots of vendors there that provide services to this population. But we really just want to wrap our arms around this population, increase awareness to their family and their friends, because we find out that a lot of times the patient's dealing with the lymphedema and the aspects, but the family really doesn't know that much about it. So by bringing them to this event, they can ask questions. They can hear the information that's being presented there as well.
Right.
But it's really a great way, we have found in our community, for us to kind of wrap our arms around these people, show our support for something that not a lot of people understand or get,
Right.
and they get a lot of support from each other. Everybody comes in wearing a sleeve, or let me show you my stockings,
Oh, yeah.
and different things. So I think it's just a great event, so that more people ask questions, more people are accepting of it, and understand, look, I'm not alone in this, and I've got my healthcare providers, I've got my family and friends, to really just recognize this event so that we know what lymphedema is, we know who's at risk, how to prevent it, what we're looking for, and just so that we can really address these issues and manage it much more comprehensively than what we're doing now.
Well, you're doing a great job in the community, and
Well,
I
thank
know
you.
as we have done health and wellness programs, we've always been proud to have physical therapy for women to be present.
Well, great. Thank
because
you.
we know how important that is, and it is a reality many times of the secondary reason that we know of. So I've learned a
Yeah.
lot knowing about it being in the family line. So
Yeah.
I'm glad to learn that, because that's very important to me.
Yeah.
But you mentioned this event being held at your office.
Yes.
But can you tell us a little bit about where you're located?
Yes.
And how to get in touch with you?
Sure. We are here in Wilmington, North Carolina. And our address should be shown on the screen, but it's 1630 Military Cutoff Road. And the best ways to reach us, yes, you can call us, but our therapists are busy, so the chances of someone being available is not always that great. But feel free to call. The number on the screen. We also have a website. It's ptforwomen.com. And on there's lots of articles and different information. And there's also an Ask a Therapist section on there. So if you have a question, you can remain anonymous if you would like. Sometimes the questions are very personal and people would rather just remain anonymous. But you can ask the therapist a question. We'll respond to that. Or, like us on Facebook. And we run lots of articles and different things on social media as well. So get in touch with us if there's questions that we can address or help direct you in. We'd be glad to do that. We are very passionate about lymphedema and physical therapy and women's health. So anything that we can do to help our community and even those outside our community, we would love the opportunity to do so.
And I'm excited, too, for the programs that you've opened up for men.
Yes.
And the awareness of that as well.
Yeah.
And to know that, and sometimes even women or men are uncomfortable with knowing that they're coming into a mixed wing.
Yeah.
So to know that you have that separate as well.
Yeah.
Well, I'm looking forward to that event.
Well, good.
And
good. We are too.
you have
We're
a
excited.
beautiful location. I mean, it is just right there, and it's. I know when I came in and saw it, I was so impressed. It's beautifully
It's
done.
given us
So-
a lot of room and just
Good
a
job.
lot of, thank you. Thank
well,
you.
absolutely. Well, we're looking forward to it. And we're so thankful to have you here with us at Focusing on You. Jennifer's has been a wonderful presenter and guest this evening. I think you've learned a lot. I know I have. And so, but this particular program, you've been able to see this live tonight. But starting, you'll be able to see it again next week, next Tuesday, because our Focused on You is a live program on the second and fourth Tuesday of every month, but then it's re-aired on the first and third Tuesday of each month. And all of our programs, after they have been recorded, they are then archived on our website, so you can go under the webcast tab on our website and be able to see any of the programs. And that's refreshing, you know, to be able to say, well, I missed something. You can go back and see it. But you can also view it, this program live on our website. You can look at, we have a mobile app we're very proud of that you can download that from the website, the App Store, and you can view it from there. Facebook Live. and our new Roku app that we have that you can go to and look for Hope Abounds Inc. So we're very excited about our new Roku app and trying to promote that. But all of our recorded educational videos are also viewed on iTunes as podcasts. So we look for our podcast at Hope Abounds Inc. on your iTunes account. So we're very thankful for our guest speakers that enlighten us and encourage us, give us the avenues that we need, and to always keep foremost in mind. But we always encourage you, and I know that Jennifer and I share this, and it was her piece of advice and mine as well. Be your own advocate. And know your body, know your family, know when you need to look into getting some assistance and some help, and know that between Hope Abounds and the various organizations that we bring before you, we're here for you. This is for your purpose, to make you stronger and to give you those tools that you need to work with. So thank you. Thank you for being with us tonight.